Welcome to Axiom Answers. My name is Dr. Eric Shoemake, and I want to ask you a question today. Do you have an Advil deficiency? So, we're going to use this question not just to help you with things like joint pain and headaches and things like that, but also how to think about changing your health and taking control of your health moving forward and looking at this differently than our traditional sick care pill popping model. So, if you're tired of that, then stay tuned. So, the question is this: do you have an Advil deficiency? So if you have, say, your knee hurts or you have a headache, and you take an Advil or some other non-steroidal anti-inflammatory medication like Nuprin or Motrin or Aleve, those things are called non-steroidal anti-inflammatories. Now, if that gets rid of your pain, if that stops the pain for a while, the question is, did it cure an Advil deficiency? And the answer to that is obviously not. What did it do? It didn't fix the cause of the problem. It just blocked the pain nerve to your head. So you're still getting the pain signal to your head. It's just being blocked. So you've just ignored that problem. So when you think about this in terms of how to go about this, a more holistic way and a much more healthy way, you got to look at these things like headaches and joint pain as a warning sign, just like the oil light that comes on in your car. So if you have a headache or if you have joint pain, back pain, sciatica, insomnia, sinus problems, are any of these things caused by a drug deficiency? And the answer is no. Insomnia is not caused by a Benadryl deficiency. Sinus problems aren't caused by a Claritin deficiency. So if you take those things and the Benadryl knocks you out, all it did was put a piece of duct tape over this oil light. And the thing is, no one would drive your car that way because you know your car would blow up. You still know the car needs oil, but you just stuck a piece of duct tape over it so you don't see it anymore. Well, that's what happens when you take some type of non-steroidal anti-inflammatory for your headache or your back pain or your joint pain. So, what's a better way to do this? Well, the better way to do this is see this as okay, I have X symptom. So, what I need to investigate is why do I have that symptom? So, you need to ask the question, what? No, I'm sorry, why? Why do you have that problem? Not what medication do I take, but why do I have that problem? And if it goes, and you just go back to a principle that you lean on, this change of your paradigm shift, like I talk about, your paradigm needs to start here. And this is from B.J. Palmer, 100 years ago. Nature needs no help to heal you, just no interference. So your body doesn't need any help for you to be healthy. It just needs no interference. So if you're having symptoms of whatever you're dealing with, headaches, back pain, digestive problems, joint issues, you got to ask the question, what is the source of the interference here? Okay. We have a saying that says disease is one thing, not many. Disease isn't 14,000 different diseases. All those diseases can be boiled down to one thing: interference into the way your body was designed to function. If it's working without interference, you're going to be healthy. If it's working with interference, that's where you're going to have the symptoms. So you got to look at, okay, what could be causing this interference in my body that would be causing this joint pain or this headache or whatever that we're dealing with. So we'll go through a couple of ideas here. So we've made this very simple for you. We call these the five essentials of real health. These are the sources of interference that you could have. So there's five of these. So you got one, two, three, four, five, right? So your first one would be looking at your spine and nervous system because your nervous system controls everything in your body. So a lot of people don't understand that if you have damage to the nerve in your neck that goes into your head, well, if that nerve is being pinched from sitting on a computer too much or tech neck, that could be the number one cause of your headache right there. 90% of headaches are caused by what's called cervicogenic headache, which is damage or irritation to the nerve in your neck because of the literal misalignment at C1 and C2. That's a chiropractic problem. You see a chiropractor, especially a corrective care chiropractor that takes x-rays and identifies it and corrects that. That's the fix. I can't tell you how many patients I've had that have come in with lifelong migraine headaches. Kim is a good example. She had migraines for 20 years, comes in, we take an x-ray of her neck. The problem the entire time is coming from damage and irritation to the nerve in her neck going to the head. She had tried Botox, she had tried medications, she had tried Oxycontin, all of these things. None of those things fixed her problem because her headache was not caused by a Botox or a drug deficiency. It was caused by damage to the nerve in her neck that was correctable. right? So now we could take that further. Let's say you're having issues with arthritis, like your joints really hurt. So instead of taking non-steroidal anti-inflammatories, which by the way are the number one cause of hospitalization amongst those medications, so 100,000 people are hospitalized every year from non-steroidal over-the-counter medications like Advil. 16,000 people die every single year from those. That's more than AIDS. And it's the number one cause of kidney failure. So obviously not a good idea. So could my nutrition be causing this joint pain that I'm having, this knee pain or this arthritis? The answer is absolutely yes. So we go through a couple of things in our clinic. One would be looking at the processed food or sugar, which causes inflammation, the wrong fats, which literally cause inflammation. The definition of a good fat versus bad fat: a bad fat causes inflammation. Good fats reduce inflammation. So nutrition, can making nutrition changes get rid of your joint pain? Yes, absolutely, because it gets rid of inflammation. And then we look at mindset, which is in the middle here, because we look at sleep and stress. So let's say I go back to the headache example. Could stress be causing a headache? Absolutely. Could lack of sleep be causing a headache? Absolutely. So there's things that we can do to help you with sleep. So the whole thing is like just identify what may be causing these areas of interference, and we can help you with the tools for all of these things. There's tools to correct your spine. There's tools to correct your nutrition. We have what's called the core plan and the advanced plan. We have a whole 30-day meal plan for how I've seen people reverse their diabetes, get rid of their arthritis problems. Mindset, we can help you with sleep. There's supplements for sleeping. There's different things called like binaural beats. There's a lot of things that you can do to help with sleep and stress. Then you get over here to oxygen and exercise. So let's say you have high blood pressure or high blood sugar. Well, could that be from a lack of exercise? Could lack of exercise be causing interference to your body's ability to heal and be well? Because we know that your body has an amazing ability to heal and be well. 50,000 cells die and get replaced every second in your body. You have a sodium potassium pump that's working trillions of times every minute inside of your body that you never have to think of. That power is inside of your body. So could lack of oxygen and exercise be causing your high blood pressure or your high blood sugar? The answer is yes. So it only takes 30 minutes of exercise 5 times a week, just going for a walk around the block. That lowers blood pressure more than blood pressure medication. And then over here, minimizing toxins. Could toxins be causing interference to your body? And the answer to that again is yes. Let's take blood pressure. If you have, toxins from foods like, or from your foods like glyphosate, that could absolutely cause issues with blood pressure. It could cause issues with sleep problems, can cause memory issues, and all of those issues. So we could teach you how to detoxify your house. So how to stop using shampoos with things like SLS and DEA and PG and propylene glycol and all of these things that actually have been shown to cause interference to your body. We can show you how to change that. So that's what we do in our office is we look at this as a 5 essential approach. Maybe it's one thing, one area of interference causing your symptom that you're dealing with, plug in whatever symptom that is. Maybe it's 3 areas, maybe it's all 5. But that's the way that you actually get to the cause of your problem and you get off this merry-go-round of popping pills and popping pills and popping pills on your way to the nursing home. Our job is that you end up on the cruise ship, and the way to do that is you understand, okay, this symptom is not an Advil deficiency. This symptom is some type of interference to my body's amazing ability to heal and be well. How do I remove that interference and let my body do what it was designed to do? And it's as simple as that. And when you do that, amazing things happen. So if you're having problems with any of these issues that you want help with, you could talk to us in the office. You can check out our website, axiomhs.com, Axiom Health Solutions, or you can make an appointment to come in the office and we can sit down. If you go to that same website, axiomhs.com, you can request an appointment to sit down with us and we can find out what's causing your problem. If you are a patient in the office and you want more information on how to plug into any of these essentials, we have so many resources for you. Just let one of us know and we'll sit down, have a conversation with you and get you on the way and get you on the path to healing because that's our goal is that you heal and function as well as you possibly can.